This PowerPoint is over the cause and effects of asthma. Asthma is known to affect the lungs, but it also can take a toll on various other organs throughout the body. We are going to go over what happens to the entire body during an asthma episode. Asthma is an incurable condition, and in America there are almost 26 million people that have asthma, and it costs the government an estimate of $56 billion a year. Some things in a house that are commonly known to irritate asthmatics' bronchioles are dust mites, cat and or dog dander, cockroaches, and a plethora of different funguses, household cleaners, and aerosols, and some paints with very strong smells, especially spray paints. A few irritants in the home that are not so well known are anti-inflammatory drugs and antibiotics. Other asthma exacerbation causes in the home can be inhaled particle from wood-burning stoves, burning fossil fuels for heat, and burning gas for appliances and fireplaces. There are many irritants in the environment just like in the home. Some examples are pollution from traffic, the ozone layer, sulfur, airborne fungus, breathing in secondhand smoke, and the chemicals used to clean your pool and keep it clean. Other asthmatic issues can be from occupational environments like fumes from fertilizers while farming, cleaning chemicals used in janitorial work, and the toxic fumes inhaled while making and manufacturing plastic products. Other causes can be normal daily activities like exercise, vigorous physical activity. Obesity is also a risk for developing asthma. Some doctors believe hereditary or genetics can be a reason for asthma development. Various pregnancy factors can be a cause as well, like the use of antibiotics during pregnancy, weight gain in early pregnancy, and even delivery by cesarean section. However, the use of fish oil in pregnancy is believed to reduce chances of asthma development. Most effects of asthma take place in the lungs. The muscle tissue of bronchial walls goes into spasms. The airways then swell, stimulating the bronchial muscles to contract and secrete mucus into air spaces. The mast cells release histamine and leukotrienes to bring white blood cells to the area, which causes inflammation, and bronchoconstriction occurs, which narrows the airways. Another area affected is the heart, because asthma attacks increase the risk of coronary heart disease, stroke, cardiovascular disease, and the risk of heart failure. The digestive system is also affected by asthma attacks. The attacks can cause cellular atrophy, which is when the stomach begins to degenerate and form lesions, hemodynamic alterations where the gastric folds in the stomach go through numerous changes, and can also cause structure abnormalities in the small intestines. The uterus is affected by asthmatics also. For example, asthma symptoms worsen on days 10 through 22 of the menstrual cycle, wheezing increases during ovulation, and having an increased BMI of over 23 will create more coughing during ovulation. Asthma takes its toll on the nervous system because immune cells being triggered when inflammation of the bronchi occurs. It is theorized that if there was a way to shut down specific nerves, it could help decrease asthma attacks. Symptoms of asthma can be tightness in the chest, wheezing, being short of breath, and coughing, which can be more extreme at night. Early warning signs of asthma can be trouble sleeping, losing breath easily, feeling fatigued, numerous upper respiratory infections and cold symptoms, and negative emotional issues. There is no cure for asthma, but there are some ways of controlling the disease. The routine use of controlled inhalers, leukotriene modifiers, long-acting beta agonist, and theophylline. There is also a surgery called bronchial thermoplasty. Some of the long-term asthma controllers are called inhaled corticosteroids, which are anti-inflammatory drugs, and leukotriene modifiers, which block chemicals in the immune system that cause asthma symptoms. A few other long-term asthma controllers are called long-acting beta agonists, which open airwaves and reduce swelling. Combination inhalers, which contain both corticosteroids and long-acting beta agonists that reduce swelling, tightening, they open the airwaves and prevent nighttime symptoms. Theophylline is a pill for mild asthma symptoms. For a sudden attack, the use of quick relief medication is necessary. Albuterol starts working in minutes and can be effective for up to 4 to 6 hours. Atrovent is prescribed for emphysema but can also be used for asthma attacks. Prednisone is taken to treat severe asthma attacks but should only be used for a short time because of their side effects. Allergy medication for asthma can be nose sprays and oral medication, which both help to reduce inflammation. Some asthmatics have to receive injections if regular allergy medication is not working. The injections are used for airborne allergies, but can cause an allergic reaction called anaphylaxis, which can be fatal. Bronchial thermoplasty is an invasive therapy used only in severe asthmatics to reduce the airway's smooth muscle mass. Recent data has shown long-term safety and quality of life with this procedure. The consequences of asthma are mostly caused by the lack of prescription use or the side effects of the same needed prescriptions. Inhaled corticosteroids cause oral yeast infections and throat irritations. The leukotriene receptor antagonists cause headaches, heartburn, fatigue, indigestion, and dizziness. Theophylline can cause a rapid heartbeat, headaches, indigestion, anxiety, diarrhea, loss of appetite, heartburn, and nausea. In conclusion, asthma is a very unfortunate disease, but if properly controlled, it will not interfere with an otherwise normal, healthy lifestyle.